Good afternoon. I'm Dr. Monique Mondesir with Optimal Care Pediatrics located in St. Lucie West. Welcome. Today I have Cheryl Mitchell, a pediatric speech therapist with me, and we're going to go through various topics related to speech therapy. Welcome.
Thank you for having me.
All right. So our first question is, what is a speech pathologist?
Okay. A speech pathologist has we're professionals who have training and expertise in evaluating, identifying, and treating those with speech and language disorders.
Okay. So what type of training do you have?
Okay, so I have, and most speech therapists have, a bachelor's degree in something that's related to speech and language, and then they'll have a master's degree. Mine is Master's of Science in Communication Disorders. And after that, you have to sit for a national exam called the Praxis. And so once you've passed that national exam, there's usually state licensure. And there's also, it's called ASHA, American Speech Language and Hearing Association, that is wonderful. You'd want to be a part of anyway. But most, I would say a lot of things require that. So yes.
Okay, thank you. And going on to some developmental items, what age should the baby have his or her first words?
I would say around a year. Okay. Around a year. There's a lot that happens before then, as we know, but I would say the first meaningful words at a year. Okay. And that's, something that the child uses consistently.
Like what? What are common first words?
It could be dada, but just know that, at 3 months or 4 months, that the baby's going to start cooing and making those sounds and hearing its voice. And that's wonderful. It's beautiful. That's the foundation. And at about 6 months, you get this babbling. It's that dad, 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 ma, 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 pa, 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 da, da, da. And so they might say da, 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 but it's probably not meaningful until probably around 9 months of age. And you'll know that because they'll look at daddy and say da, da whenever he walks in the room.
Okay.
Yeah. So meaningful words about 12 months, about a year old.
Okay. And what can a parent do to encourage a child to speak?
Oh gosh. Okay. My first visual.
All right. Awesome.
Okay. I just loved this picture. It just made me so happy. So face-to-face interaction is that's where it's at. It's the eye contact and being in close proximity with your baby. And the vocalizations are so important too. And I was just looking up some studies, and it was Dr. Lee Long that looked up the eye gaze of the infant. And whenever that eye gaze is direct, the brain waves mirrored those of the moms. And so you're actually stimulating the brain directly. And it was interesting because the mom was doing different things with the babies, and she would look off and it would stop. She would look right back, and that eye gaze, they would mirror each other. So that was just awesome. And there was another study that I just loved too, Felderman, that looked at vocalizations. And whenever you're in this type of eye gaze with vocalizations, the heart rate actually synchronizes. Wow. So I just thought that was beautiful. So it's so important in so many ways, but it actually stimulates the brain, the heart, all development.
So talking with baby, singing with baby, reading with
treating
baby.
them as a conversational partner,
Okay, I like that.
Yes, conversational partner. And eye contact, vocalizations. Something else I'll come back to too is FaceTime is so much better than screen time. FaceTime is just the best.
So not the FaceTime on
Yes,
phone.
that's right.
That's the real deal.
The FaceTime, that's right. This kind of communication. But other than that, as they're growing, you're reading books. And I have this little picture because I just love it. I just thought it was great. This little girl just staring at that book. Okay, and I have some notes on here about reading. Don't feel the need to read everything on the page to the child, especially when they're this young. Sometimes it's just a board book and you're just picking up the book and you're just talking about what's going on in the pictures. You're saying moon, light on, fire, hot. So you're just really talking about what's going on.
Because sometimes I get parents that'll say, well, he won't sit still for the book.
That's right.
And he just puts it in his mouth.
Yeah, exactly. And at that point, honestly, kids are just understanding that this is a book and you hold it this way and not this way. Mm-hmm. And they're understanding that the print goes in this direction, that usually pictures are at the top. Mm-hmm. and they're learning how to turn the pages. Help them turn the pages. And you're just labeling. And when I say label, I just mean telling them the names of everything in the book. And you can also read the book, but you're right, depending on the child's attention span, they're just, you don't want to lose them.
Right.
So let them turn the pages and label and make animal noises and whatnot.
Right. And it's okay if you don't get through the whole book.
That's exactly right. And that's what we do. You get halfway through and they're not interested and you say, bye-bye book. And then you put it in the basket. We'll put it in the basket. Mm-hmm. So, and tell them what you're doing too. That's huge.
Excellent. Next question. Are preterm infants more likely to have speech delays?
They are, and it depends on how preterm, how at risk that child is. I know it's important to look at the adjusted, age of the child. So I think they are. I think we really just need to watch those milestones. And if your baby misses a milestone, you definitely need to be concerned, but talk to your pediatrician for sure.
Right. So that's why all those well visits are very important, because we gauge speech and all those developmental milestones at every well visit. So make sure you're keeping all your appointments.
Great point.
And when should a parent be concerned if their child is not speaking?
I would say around 14 months of age, if they haven't said that first word, that meaningful first word, I'd be a little concerned. Also, if your baby is, getting, if he's 8 months old and not babbling, not cooing, not smiling, and I hear it from parents all the time, looking back, children that do have disorders, they'll say, he was such a good baby, he never cried. And I'll say, you want those type of vocalizations, because at, 4 months, those vocalizations tell us they're happy or they're uncomfortable or they need to be changed or fed, and they're differentiated cries. So you want that baby to be vocalizing, cooing, starting to babble, and then talking around a year. But yes, if you get to about 14 months of age and you're like, I haven't heard that yet, then that's the time.
So what should the concerned parent do?
Okay, so the concerned parent, and talk to their pediatrician for sure. Let's see, and I looked at just some local services we have here. Easter Seals was one that I talked to the lady, and she was wonderful. You can look it up online, Easter Seals, and it also is called Early Steps, but that's a birth to 3, and they do all the testing. Now you do have to meet eligibility to be assigned a therapist, exactly, but that is a great place to start if your child is birth to 3. And it's not just talking either. If he's choking, if he's not sitting up properly, if he's not, they offer a range of services. So birth to 3, the Easter Seals Early Steps is wonderful. And then if your child doesn't qualify, you can always seek out a private speech therapist, because as a mom, when something's a little off, or, maybe he's not that bad, but you just want to work on something. So you can always seek out, private help as well. And Fiddlers is something that, and they also have Child Find is what they call it. And that is a 3 to 5-year-old. And this is really just for the screening. The screening, if your child fails the screening, they'll call the exceptional student education with the public school system. And they actually do the evaluation. And then if the child qualifies, then you go from there. But you want to start with Child Find.
So Child Find would be from 3 and up.
Exactly. Okay. And don't wait until your child is already 3. If you're anticipating there's an issue, especially if you're already part of the Easter Seals program, because they're about 2 months behind even in screening. So by the time you get your child screened and then evaluated and then put in a program, it could be months and months. So I would be ready.
Exactly.
Yeah, exactly.
And next question. So what actually goes on? We've done the evaluation, we've been assigned a speech therapist, and we're going to go on X date. So what's going to happen?
Right.
When you get there?
Right. Well, it helps if, myself, I do my own evaluation. So that evaluation gives us just really good information. We look at where the child did not meet that criteria, and we kind of base our therapy and our goal writing on that. Okay. So it depends on what the child's issues were. If it's articulation, maybe we're teaching placement. We have a big mirror, and I have all different kinds of things that I'm just kind of showing the child, what are the articulators? It's the lips and the tongue and the teeth and the palate. And they're looking in the mirror and they're getting comfortable with me touching their face and knowing, what happens whenever you tap your tongue in the front of your mouth and duh, duh, duh. And if your voice is on, duh versus off. So it's just making them very aware and then teaching them proper placement and production. And then we're actually saying the sound. And you start at the sound level, the word level, the phrase level. But therapy will look very different for a language impaired child.
Okay.
Because if the child is language impaired, maybe they don't even have expressive language. They're not even talking. So you're starting with the receptive portion, which is the understanding. You're looking at books. And a lot of, another thing that I wanted to mention too with the books, these board books, this is like my favorite, Brown Bear, because of the repetitive text that's over and over again. This is one that I do love to read because it's so simple. And it's, yellow duck, what do you see? I see a blue horse looking at me. And when you turn it, it's essentially the same language, but it's just changing up. It's a blue horse now. But you're asking, what do you see? On each one, so you're giving them question form, you're giving them statement form, they're learning the color, they're learning the animal. So at any rate, a lot of these board books have what we call repetitive text over and over again, and they need to hear those language forms over and over again to understand how to string language together.
Okay.
So
good point.
Yes. Yeah. So it'll depend on where the child is with their language. If we're working on pretend play, if they don't have words, or maybe they can't ask a question. It's the kid that tells you, I need to go to the bathroom instead of may I or can I go to the bathroom? So, you're practicing question form and doing things.
Okay. So you mentioned a couple of types of conditions that you treat. Can you go in depth with that?
Yes. There's so many different conditions out there. I've kind of specialized to a certain degree, just based on the children that have been in my life and how I've educated myself to help them. I love reading. And when I was in Birmingham, I was with communication and reading therapies. And I thought, my boss was making me go to what's called Orton-Gillingham. So if your child has reading difficulty, the word Orton-Gillingham, he was the original person that said this is what dyslexia is. But I realized the pieces of the puzzle that go together with, sound perception, learning how to speak, learning how to read, learning how to write, them hearing the rhyming patterns, a lot of what we do in speech and language, were a lot of the kids that were on that spectrum of dyslexia sometimes as well. So I love that. I love dyslexic students, individuals, and they're usually very bright, but their brain is just organized very differently. So it's very multisensory, so that's exciting. I also have articulation students that are just really stuck on that R or L or, and some older kids that I'll hear talk. And if I know their parents well enough, I'll say, okay, have you noticed? And that's the problem. A lot of times parents don't notice. They're so used to hearing their child and interpreting what they say, and they don't even realize. But so it's a gift if you can give your child that gift, of having that clear speech. So yes, articulation, even if it's later.
And so what can a parent do to help? So they've gone to several sessions, and mom and dad want to help at home.
Right.
What do they do?
Right. Well, talking to their speech therapist, knowing their goals, and knowing how that speech therapist works on those goals. They can go home and do the same things.
Okay.
And a lot of times I send videos of me doing whatever it is, and I'll say, do this.
Okay, so they get homework.
Yes, they do have homework. But reading to your child is great. Pointing to those pictures. Another thing is, as a child is learning their words, holding that item up close to your face is really helpful because it gives them the visual information of how to say it.
Okay.
So, when a child is learning, it's book. You want the book? Yes, you want the book. And you give it to them or whatever it is. So you're kind of holding it up, giving them the visual cues is helpful.
Excellent. And why are there so many kids with autism in speech therapy? So what is the link with autism and speech development or speech delay?
Right. Well, a lot of times they are delayed. They're missing those milestones. They don't start the babbling. A lot of times the eye gaze is really not there. And sometimes parents don't even realize it. So it's not just the acquisition of the language and the words, but we use language as a tool. And so they're not really understanding how to use that language as a tool to get what they want and what they need. But there are other aspects of language too, like social language. It's called pragmatics. And it's body language and tone and understanding humor and figurative speech. So it's all that, yeah. And with students with autism, it's being really specific because they don't learn those things naturally. So it's me saying, check in with your eyes, turn your shoulders toward the speaker, close the conversation by saying goodbye, and we work on how to structure conversations so they're more natural.
Okay. Excellent. Thank you for explaining that. And do you also help with feeding issues?
Yes, speech therapists do. I can't say that it's my specialty, but yes, they do. And actually, my sister-in-law was a speech therapist that worked in Atlanta in the hospital whenever infants did not suckle properly. And, she started right away. So it was that feeding, getting that suckle, especially with the premature baby. So I do work on feeding. It's, like I said, it's not my specialty. But yes, speech therapists are a good place to start with feeding. I was going to say, was this your picky eating question?
Yes, I do. Because I get a lot of questions too about, well, what do we do with the picky eater?
No, it can be really stressful because it's your time that you sit down together as a family and then he's not going to eat it. Or I've taken some great seminars. This is a fantastic book called Just Take a Bite. And occupational therapists are also really can be experts in this field as well. I know with my son at the time, I took this course because I really wanted to know more. Mealtime Success is what it was called. And her name was Susan Roberts, and she was wonderful helping understand and kind of making a list of all those things your child really likes, what they don't like, and then kind of categorizing them. So you can kind of figure out, okay, is it something salty? Is it something crunchy? Is he gagging because it's really soft food? Does he not like the texture, the flavor? And so you kind of have to figure out, and a lot of that is making a little list of things that he will eat, and then using other foods as a carrier food. Okay. So that they can, if he likes that really crunchy cracker, he can maybe dip it in something to try it, or so it's called food chaining, where you use certain food to get to other foods. But yes, speech therapy is a good place to start.
Okay, thank you. And can you comment on nonverbal communication in children, and what are some examples and why is nonverbal communication important?
Nonverbal, verbal. And it was a TED Talk I had my daughter watch the other day, actually. And it said that, 90% of communication is everything else but the words.
Right.
So if I say, you having a good day? Yeah. Well, she said yes, but her eyes were rolling. She looked back the other direction. She totally was disconnected. So really that doesn't mean yes. So the nonverbal is so important. And learning how to read that, like in your population of those with pragmatic language, in other words, social language issues, it's important. Just like you're doing it beautifully now. You're nodding and you're letting me know, yes, I'm listening. Yes, I'm understanding you. Your shoulders are turned toward me. So those are just specific things that we work on with social language.
Okay. And what age do we start to see nonverbal communication?
Oh boy, really early. I mean, as early as this little baby. She's mirroring that smile of the mom. She's cooing, she's happy right away. And, your baby starts to localize to the sound. They're turning their face, they're turning around and looking at you. All that kind of starts that nonverbal communication.
Excellent. And I have a couple questions coming in. This one is, my 12-year-old has a lisp. Is it possible to retrain her to say S's at this age?
Yes, it is. It's not too late. And that's when I talked about it's really a gift. And I'm glad you even notice it as a parent, because a lot of times it's being with my friends.
Normal,
and I'll
right?
say, she can't say her S's right. She's saying son for son. And they'll go, oh, I guess she is, And when they're young, it seems like it's cute. And then it becomes muscle memory. And then it's really hard to change. But your question about your 12-year-old, it's not too late. It does take some work and some work on your child's part. They have to be motivated. I don't know anything about your child's swallow or the child's dentition, but that s sound, often I'll take the T sound and let a little air out, because the T sound, our tongue is up and it's inside the mouth. And I shape it from the T to the S so that we can kind of retrain them to keep their tongue in the mouth instead of. And you also work a lot with a mirror. I would say get in front of the bathroom mirror with your child and see if they can do it. You know, you can do the S 2 different ways. You could put the tongue tip down, or you could lift it up. But either way, see if they can even make that sound with their teeth together, and see if they're motivated. If so, let the speech therapist know at the school. I don't know if they would qualify, but maybe she can give you someone's name or at least give you some tips to try at home. Not too late.
While we're on that topic, you showed me a great tool for kids with low oral motor tone.
Yes.
So if we could show that, I thought that was phenomenal.
Yes. So, and this also kind of goes with oral facial myology, which is, I had my first child, it was years ago, with a tongue tie. And the pediatrician thought it was no big deal, but I've seen some of the later effects of being tongue-tied. And so we went to, her name is Sandra Holtzman, and she's with Myofacial. She works only with the muscles of the mouth. Okay. And so she was amazing. She kind of walked us through the whole surgery and what I needed to do to get his tongue in place so it could essentially move the way it was supposed to move now that it had the mobility. So building on that, what I learned from her that was so important was the resting tongue placement, or the resting placement of the tongue. It should be on the palate of the mouth. So your lips should be closed, your teeth should be closed, and your tongue should be on the roof of your mouth. So almost like when you go,
right.
You're sucking it up, it should be suctioned up there. Mm-hmm. And it's major, because what happens, and we see it in a lot of different even syndromes, they are like this, and their mouth is open, their tongue is on the bottom, they become a mouth breather, your whole posture changes, you kind of cave in, all of a sudden you're not using all these muscles. Mm-hmm. So we want to start with our tongue, that's probably one of the most important things, being on the roof of your mouth, closing your lips, and it keeps everything working and engaged, and it'll help your posture too. So with that, she's the one that kind of said that oral placement therapy with tool talk. And I just think tool talk is fantastic. And she has pictures of before and after of her students with Down syndrome that have that open mouth posture with that anterior tongue position. So sticking out. And they actually swallow that way too. They'll swallow that way as well. But the oral placement therapy, I would say if you know anyone in your life, if you have a loved one with Down syndrome, or really that open mouth posture positioning, this type of therapy is wonderful because it starts tongue retraction, getting that tongue back further in the mouth. It trains the swallow so that you're using your muscles properly. And then all of a sudden they can breathe through their nose and keep their mouth shut. And it really changes everything, even the way that the jaw grows. And yes, they have less problems with sleep apnea, with breathing, with sinuses. So that's definitely important.
Excellent, excellent. Do you want to show one of the pictures, like the before?
Oh, on my phone?
Yeah.
I think those were
on those were on your phone. Oh,
yes.
Not in the book. Okay.
No. But I can look one up really fast if you want.
Sure.
I can put my fingers on it.
And then I'm also going to take another question. Can a tongue tie affect speech development?
It can, absolutely. These are just some of the pictures, and I don't know. I don't know if you can really see. Okay, this little guy has a really open mouth, tongue forward placement. You see this cute little guy with his tongue out, and as cute as it is, it's really obstructing his airway. And here's a little girl that's just precious. And she's actually worked with a therapist that does that. And this is the last picture. This is just her with her smile, with her tongue retracted. And it's just a beautiful smile. We see her teeth and not her tongue. So it's fantastic.
Huge difference.
Yes.
Yeah.
What was your other question?
Well, the question was, can the tongue tie affect speech development?
It can.
Okay.
It definitely can. It can also, what bothers me too for them is the oral care. There's so many times that as we're eating, we don't even realize it. We sweep the buccal cavity. So we're going after we take a bite because we have food that, is in these up, between the teeth and the cheek. That's called the buccal cavity. But we do that constantly to clean our mouth, to clear it out. And you get more tooth decay and halitosis, some bad breath sometimes, just because they can't do that. I saw an individual that was in high school, and that, her pediatrician said, "Oh, it's no big deal. You can be understood. Don't worry about it." And it became a real psychosocial issue for her. She couldn't stick her tongue out at all. She was very restricted, felt like she had terrible breath, and she would have to go in the bathroom and actually go in there and clear, and she was constantly brushing her teeth. She was very bothered by it. So she got it done in high school and was so thrilled with the results. She could lick a lollipop. She could do all the things that she felt like she socially, stick her tongue out for a picture, be really silly. So even though you can say some of the sounds, if you're really restricted, if that tongue sticks out and it doesn't have a nice point on it, it's called a heart shape if it's being restricted.
Right.
It's probably something you want to consider. Or at least start that discussion.
Okay, excellent. And then this question came in that my 2-year-old doesn't talk. So most likely you need to have a talk with your pediatrician about next steps for an evaluation.
Definitely. And I would say simplify your language. Well, they just probably need to go for an evaluation. Definitely. So.
And this one was a good question too. Does bilingualism affect speech delay, or can lead to speech delay?
Yes, there's been so many myths out there, and I've read, experts that have said different things. So it's really, but I found no research that it delays typical development. You might get a few months where they're a little bit behind, but it's still within normal development, and you're giving your child a beautiful gift.
Exactly.
Do not. Keep on doing what you're doing.
Exactly. That's what I tell them.
So
speak the other language at home. They will learn English.
It will never cause a disorder.
Exactly.
And if there is a speech disorder, because you can have a disorder, it will be across both languages. It won't be because of that. It won't. No. So yes, keep on doing what you're doing.
Speaking 2 or 3 languages, what a gift.
Oh, it's a gift. Absolutely.
It is. And if a child comes from another country and is learning English in school, is it best to have the child put in an English only class, or is there some other approach to help the child learn English?
That was a great question. I kind of did a little bit of research. From what I read, immersion is the most natural way to pick up a language, so it's probably a good thing. I mean, granted, I think getting with if it's an ESOL professional or someone at the school, if there's anyone to translate to kind of at least, bridge that gap a bit. But it sounds like it's a good way to learn language, and they do really well. They generalize what they're learning from one language to the next. So
excellent. And as a general pediatrician, I see this a lot, ear infections. And what is the link with recurrent ear infections and speech delay?
Oh my goodness. If you have fluid in the ears at all times and you have scar tissue, children can't even hear those high frequency sounds. So the F, the S, the TH, that is very high frequency. You won't even hear those sounds if you have fluid in your ears. So kids start to drop sounds. They don't even hear things properly. And if it's like that for a long period of time, they lose the ability to even really discriminate. I'm working with a student now that has a hard time reading. He also had tons of ear infections. So he can't hear the difference between, let's say, glum and drum. It's slight, but there's a huge difference in meaning.
Sure.
He can't hear the difference between dur, gur, because his ears were not clear enough to develop that, the perception that it takes to discriminate between sounds. So it's really important. And I would say too, I had looked up just some feeding, just a reminder, just when we feed our babies, I know we're busy sometimes, never lay them flat on their back to feed them, because that really does, fluid pools, bacteria builds up, as and it can end up with ear infections and so forth. So an elevated position in feeding is really important for that.
Absolutely. So think of how you feed and you sit upright and eat.
That's right.
Then the baby should be sitting upright or held upright and eat.
Exactly.
And what age can a child start speech therapy?
I would say anytime they start missing those milestones. Talk about your concerns or what you're looking for that's not there. And if those milestones, if you have passed them and they don't even look like they're emerging, then that's definitely something that you can talk to your pediatrician or call Early Steps and say, hey, what should my child be doing? And you can even Google that. There's so many great lists on child development. What should my child be doing at 3 months, at 4 months? And it's not going to be that specific. It's going to be a range, at 4 to 6 months or 6 to 12 months. But that'll give you some good guidelines.
So if you go to the Optimal Care Pediatrics website, there's a list of developmental milestones up to the first few years, so you can check and see what your child should be doing for gross motor, fine motor, speech as well.
Awesome. That's great.
And we touched on this a little bit. What is the difference between receptive and expressive disorders?
Yes. Okay. So whenever you're testing for language, there's usually a receptive and an expression portion of the test. Okay, there's 2 different subtests, and the receptive portion is the understanding. What does your child understand? He doesn't really have to say anything. Maybe we're looking at a picture, and I'm saying, to the black dog. And he's just going to point. Does he know the black dog? He's going to point if he knows the black dog. So the receptive portion is what your child is understanding. Okay, can he follow directions? Can he point to pictures? If you tell him, pick up your shoes and place them by the door, is he going to pick up his shoes and place them by the door? So if he's not understanding you, that's a separate issue than the expression portion of him being able to communicate and talk. But the receptive portion does come first. So, when you're reading, just because your baby can't, speak, doesn't mean you shouldn't be reading and telling him the names of everything, because you're building his receptive language, his understanding of language. Yeah, and building his vocabulary.
And then what is the difference between articulation, fluency, and resonance disorders?
Oh, great. Okay. So articulation, we're just using our articulators, and we work on production and placement so that we get the correct sound. What was the second thing you said?
The fluency and resonance.
Oh, fluency. I'm so glad you said that, because I haven't even mentioned that yet. As speech therapists, we deal with fluency as well, and voice. I don't want to forget that as well, just to mention it. So fluency, we use that. I think an older school term is stuttering, but we say fluent because that's what we want from our students. We want them to be really fluent. We want smooth speech. So call it smooth speech, or at least I do. And being disfluent or having a stutter, it's not a terrible thing. And around 2 years of age, we get a lot of children that will start doing mama, 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 or, they kind of get stuck on something and bump on that word. And sometimes they're just learning language and they have so many things to say. They're trying to organize their thoughts. But then if it persists for longer than 6 months and you're really starting to notice it, they're frustrated, you need to call a speech therapist and say, okay, it's been longer than 6 months. My child is no longer 2, and we're still seeing this. So there's different kinds of stuttering. Disfluency is what it's called. But yes, and it's
very common.
It is very common, yes. And the other thing was voice. I was going to mention too. Voice, it's not only the way we speak, it's also an indicator of health. So if your kid is screaming a lot or has terrible allergies, you're going to get that hoarseness or breathiness sometimes. And if he is screaming a lot and those vocal folds are just slamming together, he could end up with nodules on his vocal folds. And I have one little girl that I work with that I never really knew what her voice sounded like because she was always so breathy and so hoarse. And I told her parents, I said, okay, I've seen her now for this period of time. I said, I don't think it's a cold. I said, let's go ahead and have the ENT take a look. And she was getting so much acid reflux. It was coming up and her vocal folds were staying so swollen that she didn't have a voice. She just had this breathy, horsey, vocalization. So yes, so voice, it's important, the quality of voice.
Absolutely.
Yes.
Thank you. You did wonderful. Thank you so much for
Thanks.
sharing so much information. Do we have another question?
As following.
Um,
Oh, there you go.
okay, there it is. I had to pull down here. Okay. My 2-year-old doesn't talk very much, but when she does, it mostly sounds like gibberish. She has a hard time enunciating her words. What are some ways we can help her hear the sounds and figure out how to form the actual words? We did have her evaluated. And they said she was on the lower end of normal. She really struggles through and is almost 2.5. Is there anything I can do with her at home?
Mm-hmm. Okay, so if the gibberish is there, I'm glad that she is having some vocalization. We do want to shape those into real words, holding those objects up, showing her the visual cues. See if she can just follow some directions as far as, give mommy a kiss, blow the kiss. Now do this for me. Ah, 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 pop, 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 pop. See if she can imitate you. If the child is having a hard time imitating, there is something called apraxia, which is a motor speech disorder. And sometimes we get those children that have a really hard time imitating. They really can't coordinate the movements to put speech together. It is a very complex task. Right now, as I'm speaking, I'm, thinking about what I'm going to say. I'm coordinating all these sounds in my words, and it's a process that some children neurologically have a really hard time doing. So you kind of have to start at the very beginning with the imitation. But I would, if the child is not able to imitate just some basic things that you do, or if it's very inconsistent, I would say definitely call a speech therapist and tell them exactly what you're concerned about. Make a little list of what she says is meaningful, maybe some sounds that she can say. But yeah, that's a great question.
Any closing thoughts or tips for us?
Gosh, I think just that FaceTime is better than screen time. I think, even when I pick my son up from school, I'll say, please put down your phone. Just from here to home, I just want to have that conversation because our kids are just kind of pulling themselves out of conversation so often with their devices, and they need to work on those social cues.
Absolutely.
Yeah, they do.
Absolutely.
Yeah.
I love that. That's a very good take home.
Thank you.
All right. Well, thank you all for joining us. Have a wonderful afternoon.